أهلا بكم في تلفزيون CardioAlex. And with us, Dr. Hossam El Gendi, consultant cardiologist and the Royal College of London representative. Hello, how are you, doctor?
Hi.
What do you think about CardioAlex 2017, and is it meeting your expectation?
CardioAlex 2017 really seems to be very impressive so far. Have been seeing lots of eminent speakers and very good lectures. So I could say yes, it's meeting my expectation.
Okay. What are you going to present this year?
Well, I kind of went into two tiers. So I went to a first tier showing the most advanced imaging, how we do cardiology in the UK using these sort of techniques. And then I went to a completely different, had another lecture where I went to a completely different ball game, and I kind of presented lots of life cases, how we deal acutely with patients who are very unwell. I really was targeting more doctors in training than your young doctors. So just trying to give them up to date how we manage our day-to-day practice. So that was my lectures in that meeting.
Okay. How do you think about the progress of cardiovascular imaging technology?
Progress very fast. So if you really think that till 1980s or even a bit earlier than this, all you could do is have very primitive knowledge about how your heart function and structure of the heart. You really kind of look at old movies and then see the doctors flashing an X-ray upside down and saying the heart is enlarged and stuff like this. Now it's so advanced to the extent you could see every single detail and you could guide every single intervention, and it's not complex and there is much less radiation exposure, so I think it's advancing really fast.
Okay. What are you expecting from advances in CMR? How will it help being important non-invasive modality?
Well, CMR is kind of a modality which has been since the 90s, and it's advancing more and more. It got the advantage it have no radiation exposure. It got the advantage it give you lots of details about the heart. Having said that, it's an expensive modality and it's kind of restricted to tertiary centers rather than bread and butter cardiology. And I kind of went through some alternative modalities which you could use, which is a bit cheaper, which could be widespread used in Egypt, like contrast echocardiography. I went through some results which show it's head-to-head to cardiac MRI in different aspects. Each modality is complementary to each other, but more important than the modality is the brain behind it, and to know why you are ordering the test and how your patient is going to benefit.
Which you consider the most important non-invasive imaging modality for detecting ischemic burden?
There is no just thing. I mean, every particular modality could be kind of applied and used in a different context. I think the question should probably be not the question, but what my feeling is we should really understand and learn which test should be we order for which particular condition, and if we need to order any test at all. So, but I could say they're all complementary to each other. As I said, more important is to build the understanding. Modality is a modality; it keeps changing all the time. Mastering the technique is not here or there; it's getting easier by the day. But the brain behind it, and as a doctor, the indications, understanding the indications, the limitations, the interpretation is more important.
Okay. At the end, we would like you to say a word to the world that about your experience in Egypt, and is it safe to visit? How did you find it?
Well, you are asking the wrong person because I'm originally from Egypt, but I adore coming here. I think it's very, very safe. Having been from London, and you probably heard what's problems happen everywhere. It's even happened our doorsteps back home. And Egypt is, even by the statistical parameters, one of the safest in the world, really. Even if you look at figures and numbers, I feel much safer walking at 2 in the morning in Alexandria than I feel when I leave my hospital late in London at 11 in the evening. So it's very, very safe.
Okay. Thank you a lot and welcome.
Thank you.
Thank you.
We hope that you enjoy and see you next year. Bye-bye.